Hi, good afternoon. This is Jessica. This is Module 5 discussion. This week we read about antibiotic resistancy. As we know, that antibiotic resistancy is an unrelenting public health threat throughout the world, not just in our area, and it's due to antibiotic overuse and misuse, which adds to the continual increase of drug resistancy to microorganisms. So we'll talk about the antibiotic stewardship, what it means, our role as healthcare providers, and as consumers, and I'll give you some examples from my experience. So our text says that antibiotic resistance is caused by widespread and sometimes unwarranted use of antibiotics, which has promoted and the development of drug-resistant bacterial strains. So what happens is that it kills the strains of bacteria that are sensitive to the drug, and the only bacteria remaining are those that replicate and those that acquire the mutation that makes them insensitive to the effects of the antibiotic. Most common antibiotic resistancies we hear about is methicillin-resistant Streptococcal aureus, or MRSA. Another one is vancomycin-resistant Enterococci. And I work in the ICU, so when a person upon admission, we swab the nares and perirectal area to see if they're positive in this for a patient pathogen as well. The antimicrobial stewardship refers to the coordinated interventions designed to improve and measure the appropriate use of antimicrobials by promoting the selection of optimal antimicrobial drug regimen, dose, duration of therapy, and route of administration. This also seeks to achieve optimal clinical outcomes related to antimicrobial use, minimize toxicity, adverse events, and reduce the cost of healthcare for infections. So how can the healthcare providers assist in this? Not to treat viral infections with antibiotics, even if the patient insists or asks for them. Doctors prescribing antibiotics only when there's absolutely necessary. Give them at the right dose, only for as long as they're needed. Avoid unnecessary overlaps in antibiotics. Not usually necessary to give 2 antibiotics treated at the same time, but I've seen in clinical practice that a patient can be on 3 different antibiotics, especially if they're septic. Also, be familiar for the resistance trends in the area in which you work. To collaborate with each other and with patients. Talk to the patients about the appropriate use of antibiotics. Not to, if they have become sick, to use antibiotic that was prescribed 6 months ago. To include microbiology cultures when placing antibiotic orders. I know in clinical practice that sometimes doctors order antibiotics before a culture has resulted, or before, like a sputum culture or a blood culture has resulted, we'll go ahead and put them on an antibiotic. So utilize patient-provider resources offered by the CDC and other professional organizations. Always stopping and assessing before prescribing antibiotics, before the doctor prescribes them. Take a moment to ask, or even have that patient advocate thoughts as, are these really necessary? What's the possible consequences of these actions? Also, patients can take antibiotics exactly as the doctor prescribes, not skipping a dose, completing their prescribed course of treatment even when they start feeling better. That's something as us as nurses that we can enforce and encourage them to finish their full antibiotic, because sometimes when people feel better, they'll stop taking their antibiotic. Only take the antibiotics prescribed to you. Do not share or use leftovers. Antibiotics treat specific types of infections, so taking them wrong may delay current treatment or allow bacteria to multiply. Do not save antibiotics for your next illness. So if a person starts feeling better, sometimes they might save it till next time they get sick. We discourage this type of process. So we encourage to discard any leftover medication once the course or treatment is completed, and not to ask for antibiotics from the doctor if you don't need them, because with every medicine there is side effects. So taking one might do more harm than good. And preventing infections, such as practicing good hand hygiene and getting recommended vaccines. Also, we can, if a person's antibiotic for patients with suppressed immune system, including those with HIV or AIDS or profound neutropenia, sometimes medications are given to these patients prophylactically, which could also put them at an increased risk for developing resistance to antibiotics. So we want to encourage the Center of Disease Control and Prevention has developed a set of guidelines preventing microbial resistance, such as preventing infections when possible. So always teaching the patient and the nurse to wash hands when appropriate, to get immunization such as your tetanus, influenza, polio, measles, and hepatitis. Also doing good catheter care, hand hygiene, and even when doing IV medications, to always making sure you're scrubbing your port. Diagnosis and treat the infection properly. So infections can be cultured. A lot of times if our patients run a temperature greater than 102, we automatically, per policy, get blood culture sent off to see what microorganism we might be dealing with. So also use antimicrobials wisely. So as they're prescribed, have a clear rationale for their use. Be able to explain that to the patient. And preventing transmission. That is, nurses contain infections and they can stop the spread by using proper infection control. Nurses should teach the patients also how proper hygiene can prevent infection. I will attach my resources to this video post. Thank you.